if it's not about genitals, what is it about trans women's bodies that you find most attractive? I paused for a second to consider the question. Then I replied that it's almost always their eyes. When I look into them, I see both endless strength and inconsolable sadness. I see someone who has overcome humiliation and abuses that would flatten the average person. I see a woman who was made to feel shame for her desires and yet had the courage to pursue them anyway. I see a woman who was forced against her will into boyhood, who held onto a dream that everybody in her life desperately tried to beat out of her, who refused to listen to the endless stream of people who told her that who she was and what she wanted was impossible. When I look into trans women's eyes, I see a profound appreciation for how fucking empowering it can be to be female. An appreciation that seems lost on many cissexual women who sadly take their female identities and anatomies for granted, or who perpetually seek to cast themselves as victims rather than instigators. In trans women's eyes, I see a wisdom that can only come from having to fight for your right to be recognized as female. A raw strength that only comes from unabashedly asserting your right to be feminine in an inhospitable world. In a trans woman's eyes, I see someone who understands that, in a culture that's seemingly fueled on male homophobic hysteria, choosing to be female and openly expressing one's femininity is not a sign of frivolousness, weakness, or passivity. It's a fucking badge of courage. Everyone loves to say that drag queens are fabulous, but no one seems to get the fact that trans women are fucking badass.
Good news, everyone! Tonight, mental health, trans medicine in history, Canada's first trans child, and more. Good news starts right now. A new study shows that gender-affirming hormone therapy is linked to lower depression in transgender adults. Shock and surprise! From CNN, gender-affirming hormone therapy may help patients with their mental health as well as their physical bodies, according to a new study. Quote, transgender, non-binary, and gender-diverse patients prescribed hormones had a 15% lower risk of moderate to severe depressive symptoms over 4 years of follow-up compared with those not prescribed hormones, said lead study author Dr. Sari Reisner, associate professor of epidemiology at University of Michigan School of Public Health, in an email. The study analyzed data from 3,592 patients of 2 federally qualified community health centers in Boston and New York City and looked at both their hormone therapy prescription and their patient health questionnaire scores, which indicated depression levels. Those participants who received hormone therapy had significantly lower risks of moderate to severe depression symptoms in their 4 years of follow-ups, according to the study published last month in the Journal of the American Medical Association Network Open. Quote, when gender-diverse patients access medically safe and effective hormone medication and care, they are more likely to experience healthier mental health outcomes over time, said Dr. Michelle Forcier, medical director for Folks Health, a mental health and wellness telehealth platform for people in the LGBTQIA+ community, and a clinician at Trans Health, a nonprofit clinic in Florence, Massachusetts. Quote, providing gender hormones did not just provide physical benefits to transgender and gender-diverse patients, but, yet again, we demonstrate that they improve their mental health outcomes as well, added Forcier, who is also Assistant Dean of Admissions at the Warren Alpert Medical School of Brown University. She was not involved in this research. The study comes amid President Donald Trump's executive orders that would restrict gender-affirming medical care for transgender youth, ban trans women from competing in most women's sports, and discharge transgender military members and recruits. Depression rates in people who are transgender, non-binary, or gender diverse are a public health crisis and need to be addressed, Reisner said. Quote, trans people experience mental health disparities with higher rates of depression and suicidality than cisgender people. Trans people are literally dying. There is an urgent need, now more than ever, to care for us, support us, and ensure we have the life-saving care that we deserve and need to thrive. An estimated 8.3% of U.S. adults have experienced at least one major depressive episode, according to the National Institute of Mental Health. But a 2023 study found that about 33% of transgender people showed symptoms of depression. The higher rates and poorer health outcomes, including anxiety, depression, and tendencies towards self-harm, including suicidality, in transgender people, can be due to many factors, but a big contributor is the effects of bias and discrimination, Forcier said. Quote, minority stress and discrimination also leads to higher risks for economic disadvantage, housing and homelessness difficulties, substance abuse, HIV, and other factors. These cumulative disadvantages can significantly impact many aspects of physical and mental health, she said. Systematic problems, including stigma, attacks on civil rights, and preventing access to health care, exacerbate mental health challenges, added Dr. Melina Wald, a clinical psychologist at a private practice, Bespoke Health, in Connecticut and New York State, via email. Wald co-founded Columbia University Medical Center's Gender and Sexuality program. Wald was also not involved in this research. Bills targeting medical care for transgender people have been on the rise, Reisner said. In 2018, quote, 2 bills were introduced. And in 2023, there were 185 bills. Recent executive orders banning gender ideology and restricting the rights of trans people have devastating mental health consequences for trans communities, he added in an email. One strength of the study was the diversity in ages, races, ethnicities, and socioeconomic statuses of the population, Forcier said. Quote, this sample is much more reflective of the diversity of the U.S. population than previous specialty clinic-based studies, she said. The U.S. is an increasingly diverse population, and medical studies that reflect this offer more valuable insights to care. The study also shows that effective hormone care might be feasible in a more diverse community setting, Forcier said. Quote, that these patients benefited from care in these various primary care clinics in a diversity of communities suggests that effective gender-affirmative hormones is no longer restricted to urban, academic, or specialty clinics, she added by email. Overall, the scientific literature shows that hormone therapy is safe and effective, Forcier said. Quote, we have more than 25 years of consistent, persistent, insistent evidence that gender-affirmative approaches to care for transgender persons offer a variety of medical and mental health benefits. There are no studies that suggest withholding medically indicated safe, effective care offers any benefit at all. That said, care for depression in the transgender population should not end at hormone therapy, Wald said. Quote, while gender-affirming hormone therapy is crucially important to improving mental health, the importance of access to evidence-based psychiatric interventions for treatments of depression should not be overlooked, she said. It is a both-and approach, rather than an either-or. A ship arrived in Edinburgh in 1809, and off stepped a new man, James Barry, an enrolling student at the city's prestigious medical school, despite nearly being refused admission, as his youthful features led many of the instructors to question if he was a boy not yet of age. He learned quickly and qualified for his MD in just 3 years. In 1812, he relocated to London to attend the surgery program at the United Colleges, which he graduated from on July 2nd, 1813. Just 4 days later, he received a British Army commission, and he was quickly promoted to assistant surgeon at the Royal Military Hospital in Plymouth. In 1816, he was sent to Cape Town, where he immediately treated the ailing child of Lord Somerset in a way described as spectacular, earning him the status of personal physician to the governor. In 1822, Somerset appointed Barry Colonial Medical Inspector, which he began to leverage to enact changes in the lives of the people of Cape Town. He overhauled the water systems, enacted a proper sanitation system, established health care for prisoners, upgraded the care for the mentally ill, created quarantine protocols for the colony, and insisted on treatment for slaves as well as colonists as a matter of public health, and called out nobles for spreading medical misinformation. Often. He also continued to excel in his individual practice, performing what many of the age would consider medical miracles, including performing the first known C-section where both mother and child survived. By a European, anyway. In his honor, the child was named James Barry Munich, a name that stayed in the family until a descendant eventually became Prime Minister of South Africa, J.B.M. Hertzog. In 1827, he was promoted to Surgeon of the Forces, but when Lord Somerset fell ill 2 years later, he abandoned his post to return to England to treat his ailing friend, where he remained until Somerset passed in 1831. He resumed his duties with a ferocity, even getting into a fight with another surgeon over improper procedure that led to a court-martial over conduct unbecoming a gentleman, which he was honorably acquitted of. Barry continued to rise through the ranks and serve all around the empire, improving medicine everywhere he went. As Inspector General of Hospitals, he fought for better food, sanitation, and proper medical care for prisoners and lepers, as well as soldiers and their families. He was relentless in his efforts to improve sanitation, nutrition, and general living conditions for oppressed groups, seemingly out of an understanding that preventing illness in the first place is just as important as knowing how to treat disease when it presents. He was outraged by unnecessary suffering, which led him to numerous confrontations with nobles and superior officers alike. Yet, no matter how harshly he was disciplined, he refused to relent. Surviving to become so old he was forced to retire, he lived long enough for photography. Seen here with his companion, who stayed with him from his time in South Africa until his passing, and their dog Psyche, in Jamaica in 1862. Folks, this man was such a legend. Charles Dickens turned his life into a story, and upon his death, when his body was prepared for burial, a funeral worker claimed to discover his sex was female and attempted to blackmail his physician for marking the death certificate male, an accusation to which he wrote, quote, "It is none of my business whether Dr. Barry was male or female," and that he was, regardless of anatomy, Inspector General of Hospitals. Naturally, the Army ordered his records be sealed for 100 years in response to the possibility of a scandal. But in the 1950s, historians were able to discover the truth, which included letters to his mother and brother revealing that attending medical school as a suitable opportunity for his transition wasn't just something they supported, it was his mother's plan in the first place. After seeing the disaster the Trump administration has been for the United States, Canada's election last week swung hard to the sane, and Mark Carney was confirmed as Prime Minister. As it turns out, Carney has a trans child, and his opponents knew and tried to leverage it in a copycat of Trump's hateful ads last year, and failed entirely. Canada, it turns out, does not approve of hateful nonsense or picking on people's children. That's a lesson for the United States. But Sasha Carney is far more than a political football. They're a philosopher with some very intriguing thoughts on the nature of gender. Here is a short essay they wrote in 2022, published in Brink. The very first thing you are told when you begin to understand yourself as transgender is that you had no choice in the matter. Born this way, born in the wrong body. These same ascriptive phrases were the soup of the day on Tumblr in my teenage years of the mid-2010s, where anxious young trans and non-binary people reassured ourselves and each other that we were born into transness. Center-left human rights discourses embrace the tendency to theorize gayness and transness alike as unchanging, essential, and instilled in the body since birth. The ease of the narrative was, and remains, excellent fodder for shiny liberal media consumption. In a 2016 Guardian profile produced, it seems, for the consumption of cis people, trans university student Keith testifies that, quote, "It's not a choice. Nothing has happened in my life to make me trans. I was born trans." Under born this way logic, identity is not something formed through living in the world, but rather a nugget of information to be excavated, polished, and eventually presented to it. The belief in an innate gender is an understandable defense against a homophobic and transphobic world. Lady Gaga sang "Born This Way" to a pre-Obergefell versus Hodges America, after all. Queers are prickly in the face of conversion therapy logic, which is correctly perceived as the attempts of dominant society to nudge aberrant desires towards a more palatable ones. If we as trans people did not choose our strangeness, if it is instead a naturalized, cradle-to-grave form of human difference, then maybe it follows that it can be tolerated in the name of equality, maybe even, in extraordinary circumstances, embraced. The alternative notion that queerness, particularly transness, is conditioned by the social rather than intrinsic to the self seems to be the domain of right-wing news outlets, Republican lawmakers, and the occasional classical liberal professor. Over the last few years, trans children have been thrown into the harsh spotlight of national news like never before. Over on Fox News, Tucker Carlson decries trans childhood as grotesque and an instance of ventriloquism where children are unwittingly puppeted to political ends. The logic of those in Carlson's camp, echoing and informing the early 2020s spate of anti-trans American legislation, what the historian Jules Gill-Peterson terms the recent emergence of the cis state, the specific wielding of state power to preserve the cisness of its subjects, is characterized by two entwined arguments. First, it is trans children who need to be protected from their own transness, their desire to transition, whether socially, hormonally, or surgically, will not help them, but rather lead them further astray. Second, and crucially, these protective interventions are required because the children in question are not truly trans. They were not born this way. Rather, they are corroded into transness, which sweeps the nation like a disease. As Nicholas Christakis, a socialist and Sterling professor at Yale, has written on Twitter, quote, "I think there is a large element of social contagion with respect to transgenderism." He placed the desire to transition in the same category as bulimia, peanut allergies, and mild autism. When members of this camp, let's call them the social contagion critics, talk about trans people, they constantly invoke the horrors of a surgically changed body in hushed, fear-stricken tones. The primary body under threat is, for the social contagion critic, that of the young teenage or prepubescent girl, or person assigned female at birth. Always white, vulnerable, and constructed as lacking its own autonomy. It must be noted here that transphobes primarily construct trans men and trans masculine people as victims of transness, and trans women and trans feminine people as predatory perpetrators of it. The body at threat is always that of a young woman, or woman, whether at risk on the operating table or in a woman's restroom. The cover of Abigail Schreier's 2020 book, Irreversible Damage, an anti-trans text I have never read and never will, features this horror embodied. A young white girl with a pixie cut and a hole where her reproductive organs should be. That a sickness has been produced in our children that might lead them to mutilate what is healthy is the greatest, most soul-striking fear of them all. As gender-affirming surgical and hormonal procedures became increasingly thinkable over the course of the last few years, with waiting lists at gender clinics swelling to years-long wait times, their visibility circulates as the transphobe's nightmare. Surgery, for the social contagion critic, is the logical endpoint of a society that allows its children to be cross-contaminated by inappropriately gendering ideas. A gender-affirming procedure is usually a life-affirming one, though statistics alone can't define the value of a trans life. A study led by Harvard T.H. Chan School of Public Health found that gender-affirming surgeries were associated with a 42% reduction in psychological distress and a 44% reduction in suicidal ideation. Even these statistical rebuttals, though, are unconvincing to the social contagion critic, since they hardly get to the heart of their fear-mongering. The transphobe is terrified of the creep of inauthenticity and wields that terror effectively. The idea that ventriloquized aberrant gender can be separated from authentic manhood or womanhood works so well because it is the process of questioning the purity of one's motivations. Your desires are not your own, transphobes of all stripes argue, not truly desired. If you can only disentangle that toxic terminology of gender from what you truly want, you will be free to be in your own body without alteration. This is ultimately premised on the idea that transness alone is inauthentic, that all other expressions of gender are naturalized. Born in the wrong body activism attempts to rebut this by naturalizing transness. By testifying to the lack of choice we had over our trans identity, we hope to make ourselves immune from the social contagion critique. But what might it mean, instead, to reveal all gender as inauthentic? Gender is inherently a process of social relation. Who you are as a woman or a man or otherwise forms in relation to the gendering of those around you. A cisgender man in a locker room may feel socially compelled towards certain motions, phrases, or stories to affirm and solidify their own manhood in the world. What is so natural about that? Ask yourself now, how do your friends perform or do gender? Your mother, your father, your partner? Is the performance of cisgender heterosexual manhood, for instance, any less determined by who you are friends with, the insecurities you have around your body, or your desire to amass social capital? Brazilian waxes and pre-workout smoothies alike are gender-affirming processes. Shaving your face or wearing a dress can be too. We can scarcely conceive of gender without these social rituals and practices. There is no true Archimedean standpoint where we can live outside gender as we speak about it, cis or trans. We are, like Heidegger's subject, always already thrown into the world as gendered beings. To rephrase Christakis, I think there is a large element of social contagion with respect to gender, not specific to trans people, but with respect to the territory of gender itself. And what of it? Of course, not all forms of social contagion are healthy or positive. Gender can hurt as much as it can heal. But I believe we, as trans people, lose more than we gain by pretending that gender has ever been separable from the realm of the social. To slightly bastardized Lady Gaga, I'm on the right track, baby. I, just like you, whoever you are, was formed this way. The Trump administration has been marked by interesting negotiation tactics of late. With China, he tried to be the loud bully, got pushback, and quietly caved. Art of the deal. With the military trans ban, he tried to be a hyper-aggressive bully, got pushback, and quietly caved. Art of the deal. Now with Maine. First, some background. At a meeting between the new president and the governors, Trump made a comment about states needing to obey him and ban trans kids in their states from competing in sports. Maine's Governor Janet Mills said no. We'll see you in court. Shortly thereafter, Trump's politicized federal agencies attempted to freeze funding for Maine schools, of particular note, the Child Nutrition Program. Naturally, since this was a clear violation of both the separation of powers and the government's duty, the state sued. Last month, a federal judge ordered that the administration unfreeze the held funds after finding that Maine was likely to succeed in the legal proceedings. Last Friday, the regime quietly dropped the matter, settling the case by giving Maine everything they wanted. Maine, in turn, agreed to drop their suit because they got everything they wanted. So, once again, Trump tried to be loud as a bully, got pushback, and quietly caved. The lesson here is when fascist cowards try to force you to obey, don't. That's the art of the deal. And while the good news should be obvious, let's say it anyway. The children and seniors will get to keep eating, and Maine's 2 trans student athletes will get to keep playing. Well done, Governor Mills. Unlike the cry-bully-in-chief, you actually are protecting the children. If you enjoy content like this, be sure to subscribe. Transpositions Weekly is the first and only weekly trans news show in the universe, and we need your support to keep this show going. Contribute at patreon.com/thetranspositions. Spread the word all over social media to let people know we're here, and tell us what stories matter to you by joining the community on Discord. Discord, of course, is where the memes live, and our meme of the week was posted by Titan Uranus. And if you need to reinstall your gender, whether with recommended settings or custom features to suit your gender functioning needs, join us. Also, if you have good news concerning trans people you'd like to see reported on, you can tell us about that in the Discord as well. For the Transpositions, I've been Ember Belrad.
All right, everyone, That's new. That's new.